Hi, Paul. What did you think of the tape?
It's powerful. I mean, there's nothing like real-life drama. You don't need actors, that's for sure. So where do I fit in, Dan?
I'll tell you when I get to the ranch.
Can you tell me what the picture's about in a sentence or two?
Sure, Paul. It's about a new way to intervene on families in pain, reaching out to other family members, not just the identified patient, especially with addictive disease.
Give it. Hey, Dan. When I got my certificate as a drug and alcohol counselor at UCLA, I obviously did it because I wanted to help. So, yeah, the answer is yes. Where do we begin?
Online Rehab Clinic attempts to give the family the experience of enjoying rehab on our equestrian center and receiving help from our companion therapists. This site allows for individual daily journaling and positive participation in a rolling patient blog supervised by the Online Rehab Clinic.
Speaking of nature, maybe it's time to ask the audience if you've noticed anything different out here other than Fred and me. And maybe some of you may have noticed that I've got something sitting close to my shoulder, sitting on my arm. And of course, this is our stand-in for the disease. And the disease can be very charming, cute, pleasant, especially when you first start using, but after a while, your disease gets embarrassing, and the family generally doesn't, has a code: don't talk, don't trust, and don't feel. And even though they may be aware of the disease being something like our companion therapist here, Wild Bill, many times the family doesn't recognize it or doesn't talk about it. They may see it, they may touch it, they may be bothered by it, they may be bit by it, but they're not going to talk about it because it's embarrassing. And that's one thing about addictions. Many times if someone has cancer, heart disease, whatever, usually people are a little more open about what they have and are very open about seeking help from their physician or the medical community. But when it comes to something like alcohol and drug addiction, even though the American Medical Association has declared it a disease in 1956, many people don't accept that definition and don't believe that it is a disease. Personally, it's a moot point if you feel it's a disease or not. The important thing is I feel it needs to be treated as a disease. And I think that's a critical point. And we found that the most success comes from recognizing it and treating addictions of all nature as a disease.